हेलो एंड नमस्कार सभी को। गुड मॉर्निंग एंड गुड इवनिंग टू ऑल। आप हमें जहां से भी सुन रहे हैं, मैं हूं आपकी होस्ट दिव्या एंड वेलकम टू टुडेज लाइव सेशन। Before starting the session, viewers, eGlobal Doctors is giving special offer on Tuesday, Thursday, and Saturday. Now talk to specialists of diabetes, skincare, and pediatrics, orthopedics, and general physician at just rupees 199. So moving to our live session. So we are back again with an exciting topic. Today we are going to discuss about the child obesity and prevention. So let's get started. For today's session, we have our expert, Dr. Jyoti Manekar. Dr. Manekar is an obesity medicine specialist and a caring and compassionate physician who likes to treat people, not just the disease. She has over 15 years of experience in taking care of patients. She has been treating overweight and obesity, which are root causes of multiple chronic medical conditions like high blood pressure, diabetes, and many more. So, Dr. Jyoti, it's really nice to meet you virtually. So, how are you doing today?
Thank you, Diva. It's nice. I'm good, and it's nice to see you again.
Yeah. So, ma'am, without any delay, should we dive into the session?
Why not?
Yeah. So, for today's session, as we are going to discuss about the obesity, child obesity. So, like my first question is, what are the main factors contributing to child obesity?
You're right, Divya. Right now, we're seeing a lot of childhood obesity along with adult obesity. There are a lot of reasons. Of course, we always think about genetic reasons. There are environmental causes. There are social reasons. So there are several factors. So again, the most common things again are environmental issues, especially with kids. If the culture in the family is a certain way, then the kids are going to follow the same. So there's a lot of environmental issues, and then there's a lot of screen time these days. So that adds to the problem as well. When we were young, we used to play outside all the time, but here lately, we don't see kids playing outside. So they're playing indoors with their thumbs. So pretty much they're exercising their thumbs more than their bodies. So I think that has a contributing factor as well, unfortunately. And then the schools do not have as much of free playtime. There are more schools in the buildings nowadays, and they do not have playgrounds. So there's no recess time. So there's no break time. So that's, I think, one of the other reasons that contributes to childhood obesity as well.
Okay, so that means these are the factors that contribute to child obesity. So, so ma'am, like how can parents encourage like healthy eating habits in children?
So there are several ways to do that. One is bringing awareness. If parents are aware and children are aware, they can then make a change. If you're not aware of it, you're not going to make a change. Traditionally, a lot of people think, oh, we have to look healthy, we have to look a certain way. But a lot of times we accumulate midsection fat weight, and that's what we call obesity or weight gain in the wrong places. We haven't seen just in adults, but also in children. So when it comes to parenting, when parents are more cautious and aware of it, that if their child is going to gain weight in the wrong places, then that's going to affect their life in future. So I would start with awareness first, bringing awareness. The second thing I would say is change the culture in the house if that's interfering with your healthy lifestyle. For example, if we always kind of say finish the plate, clean up the plate, so that's like pushing the child to eat and finish the plate. What if he's full already? If he or she is full already, let their brain hormones tell them they're full and they don't need to eat. Mom feels like, oh, if she filled the plate up, the child needs to finish it. So that tendency again carries over time, and then they tend to eat more, they stretch their stomachs more, so they don't feel full eventually when they stretch their stomachs. So very important to kind of have small plates, finish what they have. If they're full, they're done. The things that parents can control is what you're eating, when you're eating. Let the child decide how much they want to eat, whether they want to eat, they're hungry or not. But if they're not eating the right foods, of course, don't go after junk food and say, oh, let my child at least eat a biscuit or a cake because they didn't eat food. Your child is going to be alive and going to be well, but just don't put junk in their body. Now, if you kind of allow a child to say, oh, mom, I want to eat chips first. Then obviously the child is going to eat that. They'll be full and they don't want to eat the real food. So I would encourage parents to say, you know what, finish your bowl. If you want to eat chips or if you want to eat a cookie or something, it's okay. And then don't make it a reward. If you eat your vegetables, I'm going to give you a cookie. So that reward is going to make them rush and eat just to get that cookie. So those are tendencies that we kind of try to bargain with kids to get them to eat something, whether it's good or bad. So try to avoid rewards in the form of junk. So that's another one that I would kind of highly reinforce. So one is, I would say, repeated awareness. Second is let the child decide how much and whether they're hungry, and let the parent decide what they're going to eat, when they're going to eat, and where they're going to eat. And then very important thing is, again, do not reward your child with junk food. We all eat food. Yes, that is the main food. If they want to eat some dessert or something at the end, that's an option. But again, that's not the main course and it's not a reward. So I think those little 3 strategies might help. And then lastly, I would say, if you want a healthy child, parents need to be healthy in the first place. If they don't want their child to be on their phone all the time, the parent needs to put their phone down, because children emulate what their parents are doing. And a lot of times that can affect a whole lot. So if parents are eating the right foods and they're cooking at home, involving the kids, then they're going to have those healthy habits right from the get-go, instead of trying to correct things after they're kind of gone the wrong way. Then it's very hard. So start with little things at home, involve the child in cooking, and that kind of brings them the interest in the colorful foods, the texture of foods, knowing what they're putting in their foods. And then when they're eating and cooking at home, of course, you know what you're putting in there. Whereas when you get food from outside, catered, or if it is from a restaurant, of course, you don't have control over what they put in it. So those are kind of, a couple of healthy ways that you can remind yourself or teach yourself to do. And the child will automatically start following or emulating that.
Yeah. So parents should encourage healthy eating habits in children, as Dr. Jyoti mentioned. So, Dr. Jyoti, you explained the details very well and in great depth. So, what does physical activity play in preventing child obesity?
So physical activity, Divya, is a very, very important component for everyone's life, whether it's children or adults. Physical activity really is limited these days. The reason, what does physical activity do to you? It's not just to help with your cardiac health, but it also helps to improve and stimulate those hormones that make you feel good. When you're joyful and happy, less likely you want to go to eat the cookie to feel good. You see what I mean? So you have your own development of those happy hormones. So even 30 minutes of active physical activity, that happy hormone goes up and they feel relaxed and they do well. So children do the same thing. They have to have that physical activity. The recommendation is children to be physically active at least for 60 minutes every single day, and it has to be moderate to severe intensity. So it's not like, oh, I'm just going to take a little walk and come back. That's not enough for a child. So for a growing child, they need good amount of physical activity that helps them to move their muscles, because they're still growing. They need their bones getting stronger. The calcium needs to get in the bones and make them stronger. So it's very important to have that active physical activity that'll help pump their heart, increase the blood flow and oxygen to their brain and the growing body. So it helps a lot in so many different ways. And like adults, we don't want kids to be like, oh, jump on the treadmill and start running. I would say, do something that's fun. Who wants to do a routine of workout? It's not always fun. So let children be children and let them have fun. So they could kind of participate in a sports program, or if they have something offered at school, like maybe a soccer team or in a swim team or gymnastics or something that they are interested in. Or sometimes they don't know what they're interested in. Let them try out a couple things and see what they feel good about, and they can do that. The other thing is, you can turn on the music and dance when you don't have availability of all these things. It'll be fun for the parent, it'll be fun for the kid. Turn on the music and dance. It's still good as long as you keep moving. You want 1 hour of active physical activity. And believe it or not, it helps your hormones, it helps your health. And then obviously weight definitely does not go up when you do physical activity. So the magic time is until 30, whatever you do, especially when you keep moving a lot, you don't tend to gain as much, because even if you're eating the wrong foods, it may not show up right away. So under 30, you have a good chance of doing well with exercise. But after age 30, then exercise helps, but not as much as diet would. So you have the benefit when you're younger. So take full benefit when you're young. Use those hormones, use those muscles in your favor.
Yeah. So, as we just explored the role of physical activity, let's now delve into potential challenges and risks linked to childhood obesity. So, Dr. Jyoti, what factors do you think contribute to these issues and how can we address them effectively?
Sure, there are a lot of complications that can happen with weight. But before I dive into that, one more quick thing I wanted to talk about physical activity that I missed upon is when kids are active and they play some sports, they usually connect with other peers of their age. So that helps a lot with their psychological, emotional health as well, which we do not want to underscore because, like adults, children do have emotions and they do feel down and depressed. So when they're among their colleagues or sports or sports partners or in a league or something, they feel really connected. So it's very important to kind of have physical activity or sports to kind of engage them. And that has profound benefits. Coming to complications of obesity, the most common things that we find in children are high blood pressure, diabetes, and fatty liver. Those are three big things that happen in kids. And that's kind of one of the sad things. But blood pressure tends to come on pretty young, and also because of the plaque buildup in their arteries too, like adults, they know the grease sits in the lining of the arteries and they kind of stiffen up. When they're not very flexible, your blood pressure tends to go up and your heart tends to pump. And diabetes is another thing where when your sugar goes up, it's good to be sweet, but it's not good to be sweet in your blood. So when your sugar goes up in the blood, we call it diabetes. So when you're eating a lot of junk foods or calorie-rich, sugar-rich, processed foods, anything that comes in a package, remember that's not real food at all. And that can increase your sugar levels dramatically. And eating a fruit and getting sugar from that is a lot different than eating a donut or pizza and getting sugar from that. Those are two different kinds of sugars, and these sugars increase inflammation, and inflammation causes disease. And diabetes is one of those inflammatory diseases. And lastly is fatty liver, where the liver gets enlarged. So imagine having a 10-year-old with enlarged liver. It's as if you have a 60-year-old or 50-year-old who's been drinking for 30 years and he got liver enlargement or alcoholic hepatitis, same kind of thing. Fatty liver comes from sugar. So that means we're consuming, as a society, we're consuming a lot more sugar than we used to, and we're less physically active than we used to, and more stress compared to what we used to. So I think all these factor in. And those are the three big things that I see on everyday basis is, diabetes, high blood pressure, and fatty liver disease. Unfortunately, fatty liver disease does not give you any symptoms. So is diabetes, so is blood pressure. So it's hard to catch those things when they're young. So I would highly recommend that make sure you go to your pediatrician or your family physician to have your child checked out for their height, weight, and how they're growing, their growth chart. And then periodically, if there's family history, it wouldn't hurt to, again, look at their sugar levels or cholesterol levels, and also, blood pressure.
Thank you, Dr. Jyoti, for sharing the challenges and risks linked to childhood obesity.
Thank you.
Thank you, Dr. Jyoti, for providing lots of information about the topic. I think our audience has got lots of useful information about the child obesity and its prevention. So thank you so much. It's always a pleasure to have you in our live sessions. You always bring so much of information. So audience, before wrapping up the session, are you looking for an expert second medical opinion for cancer treatment? Well, look no further because eGlobal Doctors is providing access to top oncologists from across the world. So
Thank you so much,
to wrap,
Divya. I appreciate you having me today. And also, I wanted to mention quickly that I have written a book about being weight wise, and that'll be published soon in December of this year. So look out for that. It's called Weight Wise, and that talks about a lot of different little tools that you can use or behavioral changes that you could use to help improve your health and your child's health or your family's health. So that might be a tip off there as well.
yeah. So to wrap up our insightful discussion on child obesity with Dr. Jyoti, I encourage our audience to reflect on the multifaceted nature of the issue as we navigate the challenges associated with childhood obesity. So let's be proactive in implementing the practical advice shared today. So thank you, Dr. Jyoti, for sharing your expertise and guidance with us. So viewers, you can visit the website eglobaldoctors.com or download the application now. So thank you, Dr. Jyoti. It's a wrap.
Thank you. My pleasure.